Hello students, in this lecture we will see jaundice. So what is jaundice? Jaundice, also called as icterus, means yellow pigmentation of skin or sclera of eyes, that is white part, by a pigment called as bilirubin. Okay. Now from where this word jaundice is derived? It was first derived from a word called as jaune, means yellow, which is a French word, and jaunisse means yellow disease. My dear students, in ancient time it was a belief that if you see a yellow bird, it will cure jaundice, and that is why jaundice is also referred as icterus, means yellow bird. When we say jaundice is due to high levels of bilirubin. What is bilirubin? Bilirubin is a pigment and it is having a high affection towards the elastic tissues, which is having high elastin content, and that is our skin and white part, sclera of eyes. So if you see the people with jaundice, they are having yellow skin and yellow eyes. Similarly, this jaundice technically is also called as hyperbilirubinemia. Hyper means high, bilirubin means high levels of bilirubin, nemia means blood. High levels of bilirubin in blood. So this is what a general introduction about jaundice. Now, how this jaundice is caused? Before going to that, first we need to understand what is the normal metabolism, means how normally the bilirubin is produced in our body, what are its sources, and how it is transported in the body. If you understand this, it will be very easy to understand the pathophysiology behind jaundice. So first we will see its normal metabolism. Now from where we are getting bilirubin? 85% of bilirubin we get from the destruction of RBCs. RBCs have lifespan of 120 days, right? So after their 120 days are completed, they are destroyed by your macrophages. From where this macrophages comes? From your reticuloendothelial system, also called as macrophage system, right? So this macrophage, they eat RBC when they are aged after 120 days, and these RBCs are broken down into heme and globin. Now what happens to this heme and globin? Now globin means protein, so it gets converted to amino acids, whereas heme, it is the color part plus iron part. So heme gets converted to Fe, that means iron, and protoporphyrin. Now this protoporphyrin gets converted into unconjugated bilirubin. As soon as it gets converted into unconjugated bilirubin, which is generally water insoluble, so this binds to the blood albumin, and blood albumin takes it and gives it to liver. So now liver is the organ which received this unconjugated bilirubin. From blood, it has gone to liver. Now liver cells, that is your hepatocytes, they convert this unconjugated bilirubin, which is water insoluble, into conjugated bilirubin, which is water soluble, with the help of an enzyme called as uridine glucorosyl transferase. Okay. Now we have got water soluble conjugated bilirubin. Now this is water soluble, right? So it is given into bile canaliculi, through which it enters bile duct and it is transported to gall bladder, where the conjugated bilirubin is stored in bile. Okay. So now from blood it reached liver, from liver it has reached into gall bladder. Now when we are having our meals, when we have our food, this bile will act on that food in small intestine. Okay. So when this bile is acting on the food, our bile is having now conjugated bilirubin, right? So this conjugated bilirubin present in bile will get converted into urobilinogen and stercobilinogen. Urobilinogen, some part, its metabolic part will go into liver and some part in the form of urobilin will go into kidney, which will give yellow color to urine, and stercobilinogen will give color to feces. This conversion of conjugated bilirubin in intestine is taking place with the help of microbial flora. Okay. Now this is what was a normal metabolism, how it formed and how it was transported in different body parts. Now any disturbance in this normal process, okay, may lead to jaundice. What may be the disturbance? For example, the liver cells are injured. Maybe they are injured due to infections or due to certain habits of alcohol, right? The reason may be many. So as the liver cells are injured, the unconjugated bilirubin is not able to get converted into conjugated form, and so the level of unconjugated bilirubin, even conjugated bilirubin, or both may increase, and the reason for their increase we will see further, and that is nothing but commonly we called it as jaundice. So remember, if this normal physiology or normal working of the body is affected due to certain reason, it leads to the disease condition, dis-ease, discomfort. Okay. So now we will see what are the actual causes and pathophysiology related to it. So first one we will see what is the reason and pathophysiology associated with increase in unconjugated bilirubin. So first reason is extravascular hemolytic anemia. What does that mean? It means RBC cells, before completing their age of 120 days, before that only they get destructed. That early age they are macrophaged. Similarly, if in that particular person, if there is ineffective hematopoiesis, what that mean? That means there is decreased production of mature RBCs. So if mature RBCs are not formed, ultimately they are destroyed by the macrophages. So in both the cases, there is excessive destruction of RBC cells by macrophages, right? And already we have seen what is the normal physiology. That means what? They are getting converted into excessive amount of globin and heme, right? So heme, that means again heme is converted into your unconjugated bilirubin. So here liver is now not able to take that huge load and it gets exhausted converting high amount of unconjugated bilirubin into conjugated form. So what is happening? That remaining or whatever that left unconjugated bilirubin, its amount or its level is increasing, and that is seen in blood. First cause. Okay. Similarly, the conjugated bilirubin, if to a certain limit the liver has converted, that means what? Even the bile has excessive amount of conjugated bilirubin, isn't it? So even if the bile is having excess conjugated bilirubin, there are the chances that that bile pigment bilirubin, it is getting converted into stones. So in both the way the level are increased, right? So first thing, due to this first cause, what has happened? Unconjugated bilirubin has increased in blood. Similarly, whatever that excess converted conjugated bilirubin, that is secreted through bile in the intestine, excess amount, and excess amount of urobilin and stercobilinogen are converted, and they are making the urine dark yellow, and even the feces are colored dark. Okay. So in that way the conjugated bilirubin is excreted. But unconjugated bilirubin is water insoluble because it is lipid soluble. So it is not excreted out, it remains in the blood. First cause of the increased UCB. Second cause is genetic disorder. Now many of the people are seen with this syndrome called as Gilbert's syndrome, where since birth itself there is reduced enzyme, that means this uridine glucorosyl transferase enzyme is only less, and so the enzyme activity is less. That means what? The unconjugated bilirubin is not able to get converted into conjugated form. So its level is rising in the blood. Similarly, Crigler-Najjar's syndrome. This is also a genetic syndrome where the people are seen with complete absence of this enzyme which is converting unconjugated bilirubin into conjugated form. Second cause, genetic disorder. Okay. So these are probable reason where unconjugated bilirubin level is increasing. Second, we will go to increase in the conjugated bilirubin. We will see the causes and the pathophysiology associated with it. So again here first reason is genetic defect. So in this, people may be suffering from this Dubin-Johnson syndrome. Remember, this syndrome are given after the name of that person who have found this. So in this syndrome, what is happening? Whatever the transportation of conjugated bilirubin from the liver to the gallbladder, from the gallbladder to the intestine, from the intestine to the liver and kidney, right? That transportation is only defective. So what is happening? The liver is burdened with the excess amount of conjugated bilirubin, and the liver also becomes dark. It becomes black like. First reason of increase in conjugated bilirubin. Second reason, obstructive jaundice. Now the name it indicates obstruction. That means what? Whatever the conjugated bilirubin is formed, that is obstructed, that is not able to carry further or travel further. The obstruction may be in the bile duct, maybe the bile duct is blocked with gallstones, or the cancerous growth of pancreas is coming in between the bile duct, or there is cancerous growth of cells in the bile duct, or the structure of the bile or the gallbladder is inflamed due to any infection. So the reason may be many, due to which the conjugated bilirubin is remaining somewhere in the lever bile canaliculi and is not able to pass further into the gallbladder. Now due to this, what will happen? The bile is obstructed, so bile will try to find a way. It will leak through the passages and it will join the blood, where to the blood it will also give its other products, for example bile salts, acids, cholesterol, and due to this, if you see, people complained of itchiness. The people who are suffering from this jaundice, where the reason is increased level of conjugated bilirubin, this is also one of the symptoms seen. So, obstructive jaundice and genetic defect, that are the probable causes for increase in the conjugated bilirubin. Thirdly, one more reason for the cause of jaundice is increase in both unconjugated bilirubin and conjugated bilirubin. Now this happens when the person is suffering from viral hepatitis. Hepatitis is nothing but the inflammation of the liver, which becomes worse because it is not immediately detected and treated. And this hepatitis is commonly due to virus. So what this virus are doing? They are damaging the liver cells, hepatocytes. So if the liver cells are damaged, the liver cells are not able to convert unconjugated bilirubin into conjugated bilirubin, and at the same time the viruses, they are attacking the bile duct, causing blockage, damage. So the converted bilirubin, that is conjugated bilirubin, is also not able to travel further and get transported and metabolized. So due to this, what is happening? The unconjugated bilirubin level is rising in the blood. Similarly, at the same time, the conjugated bilirubin, due to inability to transport and get metabolized, its level is also increasing in the blood. And this is also one of the reason which leads to jaundice, or technically it is called as hyperbilirubinemia. Okay. So these are the etiology and pathogenesis associated with jaundice. Okay. So ultimately, if you see, if these are the reasons due to which there is increased in the level of conjugated or unconjugated bilirubin or both, then it gets accumulated, and this bilirubin pigment has high affinity towards the skin and the sclera, that is the white part of the eye. They get deposited and hence yellow color seen, and hence the disease is also called as yellow disease. So this is all about what is jaundice and how it is caused and its possible pathophysiology. Thank you.